Attention Hillsborough County, Unit 100 is now present.
I do solemnly swear or affirm that I will support, protect, and defend.
I repeat, Unit 100, your sheriff, Chad Chronister, is now here.
And I will well and faithfully perform the duties of deputy sheriff, on which I am about to enter. So help me God.
And now, the Hillsborough County Sheriff's Office brings you Keeping It 100 with Sheriff Chad Chronister.
Hello everyone, I'm your host Amanda Granite, and welcome to this special edition of Keeping It 100, where we're focusing on the coronavirus and how it's impacting our community. As always, joining us is Sheriff Chad Chronister. Hello, sir.
Hello.
And for this special episode, we also have Dr. Toni Belisle joining us to talk about everything coronavirus.
Hello.
Welcome, Doctor.
Thank you.
So let's start off with what is coronavirus, Dr. Belisle?
So coronavirus, or COVID-19, is a respiratory illness that is transmitted from person to person. It's a novel virus, so that means it's new. So we haven't been exposed to it before, so we don't have immunity to it. And so that's what's so concerning for us.
And how can it spread? How does it impact people in the community?
Certainly. So it spreads person to person. So how does it spread person to person? So through coughing or through sneezing. So it's a droplet. So if you cough, you sneeze, you project particles into the air. And so a person that's in close proximity for a prolonged period of time can contract it if potentially,
Yeah,
right?
if they're near someone who's infected.
Absolutely, absolutely.
And what can people do to protect themselves? Some basic stuff. We're going to get into what the Hillsborough County Sheriff's Office is doing, but what can the general public do to protect themselves?
So basically, standard good hygiene. That's all it requires. So wash your hands. Use a hand sanitizer. In this particular case, make sure your hand sanitizers are 60% or greater alcohol based. If it's less than that, you're not going to have the protection against any viruses, whether it's the flu or whether it's coronavirus. So the standard precautions that you would take for the flu, you would take for this virus. So washing your hands. Avoid touching your eyes, your nose, or your mouth, because if your hands are dirty, there's particles of any sort, you can infect any part of your eyes, mouth, or nose. Right now we're saying social distancing. So what does social distancing is being at least 6 feet apart from others. And so we got hand washing, we have don't touch your face, right? And we have social distancing, but also cover your coughs and your sneezes.
Pretty simple steps.
Pretty simple steps. Use a tissue if you're going to sneeze or cough. Discard the tissue, wash your hand. If you don't have either of those, go ahead and sneeze and cough more into your forearm versus into the crook of your elbow.
I'm just going to adjust your microphone real quick. So, Sheriff, HCSO is doing a lot to help protect the staff here and also subsequently protect the community, because if we stay healthy, the community can stay healthy as well. What are some of the sanitation efforts that we're doing here at Hillsborough County?
And first of all, let me thank all our employees for taking these precautionary measures. Like Dr. Belisle says, this isn't a time for panic. This is just a time to be smart. And could you ever imagine a world where someone picks up the phone and calls for help and we have no one healthy to send them?
Right.
So I commend the employees for taking this extremely seriously and taking these precautionary measures, whether it's hand sanitizing, whether they get in a position where they have to answer a call for service. We're asking citizens to meet us out in an open area, so they just reduce that close contact. We're taking a lot more calls online with our new online reporting system. We're taking a lot more calls over the phone, non-critical incidences where we don't have to respond. And again, asking them to take care of themselves, and at the same time, making sure that we're keeping the community we serve safe as well.
And I want to clear something up with the calls that we're taking over the phone or online. These aren't emergency calls. These are things that don't require an emergency response at that time, and no one is in immediate danger.
Yeah, you're exactly right. Just the opposite. These are non-critical calls that we'll take over the phone or through our new online reporting, and this does a lot of things. It saves taxpayers money. It saves a lot of time because it's so easy and convenient. I mean, it's just smart to utilize it at this time. several times throughout the year, but especially in critical times like this. There's a declared county state of emergency. It frees our deputies to go out and keep calm within the community by being seen at stores, retail outlets, so that where there's become some hysteria where everyone thinks they need to grab 800 rolls of toilet paper. There's just no need. But, you know, it allows us to be more proactive instead of reactive, dealing with, again, those non-critical calls for service.
Like vandalism or registration of bikes, things like that. We're freeing those up so the deputies can focus on what they need to focus on.
Still an important service to our community, but just allows our deputies to focus on different proactive and more priority calls for service.
Certainly. And there's a lot being done for the deputies who are out on patrol, a lot of resources available to them so that they can protect themselves personally. Hand sanitizers, gloves, kinds of explain the importance of that and the steps that they're given.
Yeah, gloves, gowns, eyewear we're working on. Again, hand sanitizer, not just any hand sanitizer, supposed to be sanitizer that's supposed to put a barrier on their hands for a couple hours. We also have taken the steps to sanitize all the HCSO facilities so they're reporting to a healthy environment. And again, this sanitizer is supposed to keep the facilities clean for at least 30 days. So we're going to take every step necessary to, again, to protect employees, to keep them healthy so they can come to work and, again, provide that critical community public service to the community we serve.
And Dr. Belisle, it's a lot of taking some personal responsibility. And if you feel sick, stay home, and knowing the symptoms. What should people be on the lookout for?
Certainly. So again, if you're ill, stay home. We're looking for fevers. So fevers of 100.4 is the fever we're looking for. Also, if you are short of breath or you have a cough. So those are the predominant symptoms.
Great. And who is most at risk for coronavirus?
So the most at risk are going to be our elderly population. And unfortunately, when I say elderly, the studies show, or the data shows, that it's going to be 60, 62 and older. And then also those, regardless of what age, those with chronic illnesses. So hypertension, diabetes, autoimmune disease, immunocompromised, those individuals are the ones that are at risk, and at risk for more serious illness.
So, you know, people should be cautious and take a look at their family and their loved ones and know the facts when it comes to protecting themselves and their family.
Absolutely. What we do know is that 80% of the individuals that will contract this coronavirus will improve spontaneously. So it's going to be symptoms of a mild cold potentially, but it's that 10 to 20% of the individuals that'll have the more critical or severe outcomes.
Dr. Belisle, there'll be a ton of people, or I mean, maybe you could talk to us about the percentage of people who will have it and won't even be, but will remain asymptomatic, never even exhibit any symptoms.
Definitely. So we'll have a number of individuals that are asymptomatic. And so that's why it's very important to practice those social distancing recommendations and the hand hygiene and the cough hygiene, so that if you're asymptomatic, meaning you don't have any symptoms, you can protect others around you. And I think that's just being prepared and being mindful of your, the other people around you.
And one of the other ways, Sheriff, that HCSO is preparing is our jails. We have the ability to serve a population through our jail systems as well. What's happening there to help protect the inmates and the staff that works there?
Yeah, a lot of people overlook that. When you have almost 3,000 inmates at any given time inside the jails, when you talk about physical harm and protecting them, you have to protect them from any type of pandemic that we're experiencing now. We've eliminated all visitation. We've allowed them, through our GTL, our telephone provider, they have 2 5-minute phone calls a week. So we want to make sure they still have that contact with their family, but that it remains a safe contact, that we're not introducing the virus into the jail system, and it will spread like wildfire inside the jails. Limiting who goes to court and doing a lot of video visitation with attorneys. So taking a bunch of precautionary measures, we've almost, in essence, locked the jail down. If you don't work there, you're not getting in there. The educators, the faith-based community partners that we work with, we've just had to take some precautionary measures to make sure that we're doing everything we can to not introduce this virus into our jail population.
And the video visitation will be really key because they can still meet with their family, they can still meet with their legal staff, they could meet with a clergy member if they needed to, but all through video visitation. So they still have that ability, it's just a different way they're going to be able to utilize it. And there's a lot of education, from what I understand, for the inmates so that they know, again, the hand washing, hygiene, important steps to take there, and also the symptoms there so that they're educated as well. They're not just in this confined area and uninformed of what's happening.
Absolutely. Their commitment is vital to the success of making sure we're combating the spread of the virus.
And Dr. Belisle, obviously you oversee the clinic, and a lot of that is interacting with employees who may be sick. What are some of the protocols over there, kind of speak to our employees? What will they experience if they come in there, and how can they get help?
Sure. So we all know that this is a very fluid environment and things are changing minute by minute. And so a couple of things that we've implemented is, one, whenever you call, if you're calling with cold symptoms or so, we are going to ask you about a travel history, or we're going to also ask you about, excuse me, travel, but also any potential exposures to somebody that has been tested positive for COVID-19. The health and wellness of all of our employees are important, and our healthcare
Certainly.
providers at the clinic as well, because if they get sick, then the clinic shuts down, and then we can't help you. So we're doing telephone triage. We're recommending that everybody that comes in to don a mask, anyone who has a fever, cough, sneezing, to don a mask and use hand sanitizers. And we're also doing some parking lot triaging. So if we know you're ill enough for potential travel history or so, we may actually go to the parking lot and assess you in the parking lot. We've isolated rooms, specific rooms, to isolate our well visits from our sick visits, and we're asking that our sick visits come more in the afternoon than in the morning, so we can keep those cohorts together, or those group of individuals together, so we can minimize the risk of our healthy employees coming in of getting anything, whether it's a common cold or the flu or now the coronavirus.
Just want everyone to stay healthy regardless of what they come ill with.
Yeah.
And that's why we
Absolutely.
had to implement a policy. If you've been traveling abroad, you have to self-quarantine for 14 days. We're not allowing you to come back to work. Again, we want to keep the rest of our workforce healthy, and then the community we serve, we don't want to be the ones responsible for spreading the virus.
Yeah. I've been seeing that graphic go around social media where it's a bunch of matches in a row, and the matches light on fire, and then the one is removed from the line. And it's the social distancing idea that if you just take one person out, it can stop the spread of the virus. And at the county level, at the state level, they've been making a lot of decisions to really promote this idea of social distancing. Sheriff, what is your message to the public right now? Obviously, they have to change their daily habits, but it's something we need to do for down the road and the health of our community down the road.
Yeah, the restrictions that were implemented today from the emergency policy group were restaurants close at 10 p.m. and bars, and that they have to be at 50% of occupancy, and I think that's a wonderful place to start. But as we continue to experience the fast spread of this virus, this is just a starting point. I think the more we social distance ourselves and sacrifice now, we won't have to do it later on, and it won't be as severe. Maybe it'll be more short-lived. The governor now just announced that all nightclubs and bars are closed effective tonight and closed altogether, so that we're kind of trying to keep up with the state and federal recommendations. It was 150 people, 100 people, 50 people, and the county went with the 50 people, no more groups of no more than 50, private and public. But the president just recommended, based on the information he received, 10 people. And I think we're going to be implementing more restrictive measures as we try to keep up with the spread of the virus. And if we don't, we're going to find ourselves in a bad way. So I just ask everyone, be patient. We're passing it on as we learn. It's spreading rapidly, and we're trying to keep up. But again, no one wants to sit at home. My wife and my 16-year-old are home. They're quarantined. No one's even coming to the house. The cleaning lady's been canceled. But I think it's important to be done, because I'm hoping if they do it for 2 weeks and everyone else continues to do it, it'll be more short-lived. The economic impact won't be an 8-month one where people are unemployed, losing their job, and bars, restaurants losing business. Maybe it can be shorter-lived if we all, again, are more aggressive on how we're going to social distance. If not, there's going to be measures in place where they're going to be enforced and forcing us to do it.
Yeah, it's not to punish anyone, but what we do right now in this week will affect this virus in the future.
This emergency policy group is to protect everyone. It's all about public health and safety. It's a fine line between individual freedom and what's in the betterment for the community, keeping them safe. And that's the fine line that you continue to have to walk, as you want to keep people safe, and at the same time not develop a a community where you're forcing people and telling them what they have to do.
Certainly. So, Doctor, I know you're new to Keeping It 100, but something we do every episode, and this one will be no different, is take questions from our followers and from the people who have submitted them to on Facebook. So for anyone who's listening on social media, you can submit any questions to our podcast by using the hashtag Keeping It 100. Some of the questions that we have for both of you for this week are, what are your biggest concerns when it comes to COVID-19 or coronavirus? Sheriff?
Mine is what we were just talking about, the spread, trying to keep up with the spread. We all are going to have to sacrifice some personal freedoms in order to get the spread of this virus under control. And I'm just asking everyone, be patient. We're passing information out as quick as we learn it and get it. And I think that's the key word here is patient. Again, I hate seeing at the grocery stores where everyone's fighting with each other because someone feels they need 800 rolls, again, of toilet paper. Listen, toilet paper and food aren't going anywhere. There's going to be plenty available. If we continue to hoard it, then some people may not get it. But I think it's important to realize this is a time for us to unite as a community and take care of one another, and not be so self-serving and everybody start hoarding supplies. There's a lot of goodwill and a lot of love that will go a long way in helping all of us through this virus.
Certainly. Doctor, for you?
So for me, my biggest concern is, excuse me, just what the sheriff said, is that we have a spike or a surge of illnesses all at the same time. And with that, the demand on our healthcare system is going to overwhelm our system. When overwhelming means overwhelming the hospital beds, overwhelming those critical care units, overwhelming the ventilators. So, maybe a little inconvenience now is going to go a long way down the road. And think about it, even though we may be young and healthy or so, think about your family member who isn't young and isn't healthy. Make those sacrifices for them, because it's not only about you, it's about your community, it's about your family. So just like Sheriff was saying about going to the grocery store and such. I heard a statistic this morning about toilet paper, and the
Which
average,
I don't know why toilet paper. Out of all the products, in a hurricane it's always water, but now why
toilet
In case you have to
toilet
stay in your
paper?
house for a long period of time.
Well, for a family of
Yes.
4, for 2 weeks, your total need is only 17 rolls total. So don't go hoarding the toilet paper.
Smart.
So it's very smart. So going back to my concern, that's my concern. So I think just an ounce of inconvenience now is going to go a long way. Be kind, be patient. We're all not comfortable about not having things to do. So brush off that book you haven't had a chance to read. Do that recipe you haven't had a chance. Plant a garden, find a way to reconnect with yourself, because social distancing does not mean isolating yourself from doing things. Dust off your bicycle, get some fresh air.
And fresh air is good at this
Fresh
point.
air
And I
is
was gonna say, I
good.
just heard that yesterday. They're encouraging people to be outdoors.
Be
Stay away
outdoors.
from other people, but it's okay to be outdoors.
It's okay to be outdoors, but keep that distance, So don't stay huddled up in your bedroom. Be out there. Do things, but be mindful. I think now is the time to have to be mindful of what you do, be mindful of others, and I think we can get through this.
Certainly. And of course, throughout all of this process, while the coronavirus is impacting our community, you can keep up with the Hillsborough County Sheriff's Office on all of our social media platforms. We're putting out information for the community, for our staff, for the employees here daily, and trying to keep you up to date and informed so that you don't have to panic. You can just know the facts and really move forward in the best light to protect you and your family. So thank you, everyone, for joining us for this special edition of Keeping It 100, and we'll see you next time.
Thank you for listening to this edition of Keeping It 100. To keep up with Team HCSO in between each episode, follow us on Twitter, Facebook, and Instagram at HCSO Sheriff.